Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are excited to welcome Dr. Jennifer Stelter to the show. Welcome, Dr. Jennifer. How are you?
Good. Thank you for having me. I appreciate it.
It's our pleasure. It's our pleasure. So would you like us to call you Dr. Jennifer, or is Jennifer okay?
Jennifer is great.
Fantastic. So Jennifer, share with us a little bit about your background and expertise as a dementia expert and as the co-founder and creator at the Dementia Connection Institute.
Absolutely. So my journey is a little bit different than most people who get into dementia care. Most people get into dementia care, whether it be a caregiver or healthcare professional, because they have known somebody who has had some form of dementia. And actually, for me, it was the reverse. I went into the field, and then after that, unfortunately, my grandmother-in-law had developed Alzheimer's disease and passed away with it. So for me, I was able to be a great asset to the family, which, is a unbelievable experience to be able to be in that space. So for me, I'm a clinical psychologist by trade. And so my first half of my career, I focused a lot in mental health, worked in a wide variety of settings with a wide range of clients. And for me, my first kind of experience in senior living was actually in mental health. I was hired on as a consultant for a long-term care company here in Illinois. And I was able to kind of take their behavioral health program to the next level. And so they were servicing folks with mental health challenges. And then, with the work that I was able to do, I actually was able to kind of rise quickly in the ranks in their operations, and was able to take on their memory care program as well, amongst some other programs, and was able to kind of revamp and revitalize that program from start to finish, and just absolutely fell in love with the population. And so a lot of networking, collaborating, educating myself, taking, of course, my experiences, my education as a psychologist as well, and really incorporating that into the programs that I was implementing for people living with dementia. And over that period of time, which is really about a 10-year period, getting to know the folks, the caregivers, right? Whether that was folks working in senior living, whether it was family members, right? Just understanding what their pain points were in this industry, and really challenged with truly understanding the disease. And what I was finding was folks who didn't really understand the disease, they were feeling so frustrated with not being able to connect with that person and provide the best care they wanted to. Their intentions were good. They wanted to be able to provide the best care, but because they didn't really understand what was going on, they felt separated from that person, right? And so I said, there's got to be a better way to educate folks, because understanding the disease is not that difficult, right? And so I said, there's got to be a better way to explain it. And so starting to kind of create a curriculum around being able to explain it, and then giving folks tools, the light bulbs were going on, right? People are having those aha moments. I have nurses, so many nurses that have told me, I've been in this industry for 25 years and I've never heard it the way you explain it. And I totally understand it now. It makes sense, right? So I said, I have something here. And so over about a 10-year period, like I mentioned, I was developing what now is called the Dementia Connection model. And I was able to do a trial period at an assisted living at the company I was consulting for, and specifically focusing this model of care within the dining process. And we took data over a 90-day period, and there was roughly around 25 residents in this qualitative study, and we found tremendous results. And so from there, I was able to pitch those results to Johns Hopkins, and Johns Hopkins said, we want you to write a book for us. And so I was able to publish in 2021, The Busy Caregiver's Guide to Advanced Alzheimer's Disease, which I'm just enamored. It's offered in so many different spaces now. Alzheimer's Association just picked it up too, which is fantastic. But with that said, I was able to then transition and open up the Dementia Connection Institute, and really kind of bring the model to senior living organizations, to families who are living at home with their loved ones, trying to care for them. And so really kind of providing as much education as possible. So long-winded story, that is my journey to date, and just excited to bring our services to many folks.
So, and we appreciate that, because as you know as well, so many families are left kind of wondering, where do I go? What do I do? What's the right way to do it? What's the wrong way to do it? And I call it kind of almost like the Wild West. I mean, if you go on Amazon and type in dementia book, there are tens of thousands of results. Some are really solid, some are really good, but some not so much, and we're trying to help the families find the resources and the tools that are going to help them and not hinder them, or are going to be practical, they're going to be helpful, therapeutic, if you will. And just like our good friends at, All's Authors, they kind of have a model that I really admire and respect tremendously. They take these books and they read them, they vet them, and if they don't pass the test, so to speak, they will not endorse them or, give their stamp of approval, which I think is really important. And I'm sure you've encountered families who, go through the Dementia Connection Institute or reach out to you, and they say, well, I bought this book, or I tried this therapy, or I bought these pills, and it didn't do anything, and for some people, I look at it as almost like a money grab. You're taking advantage of these people who don't know any better, and really exploiting their fears and their worries and their situations, and it's just awful.
Absolutely. Yeah. I mean, definitely you want to make sure that you're getting your resources from credible credible entities, right? Where people who've done their research. Absolutely. And, when Johns Hopkins offered me the book, I said, how much more credibility can you get?
I was just
right?
going to say, you don't get much more credible than Johns Hopkins, that's for sure. So let's talk briefly about the Dementia Connection Model framework. What kind of tools, like when somebody is watching this or listening to this, or maybe they just stumble upon you guys, what is the framework? What's the model look like? What's the process? What does that all entail?
Absolutely. So it's really a framework that consists of really an education or explanation of what is happening as the disease progresses. And included that is, of course, the tools that you can use. And so the framework is actually 3 pillars. The first pillar is the educational component, right? And it really talks about the theory of retrogenesis. Now, if you haven't heard about this theory, this is a theory that was actually developed by Dr. Barry Reisberg years ago. And his research pinpointed to the fact that as the disease progresses, that individual is actually moving towards infancy, right? So all skill sets. So we talk about how they walk, talk, how they eat, right? How they cope with stress. Every skill set goes in reverse, right? So we get to know these individuals as if they were 30 years old, 20 years old, 10, 5, really moving towards that kind of infantile state. And what's important for us as caregivers is to really more so understand, what does that world look like, right? Because we have expectations of the people we're caring for, that they're a grown adult and they can care for themselves. But that's not what's happening with people with dementia. They are losing those skills. Sure, they want to be able to care for themselves,
Right.
but they're not able to, because there's components in our brain that are decompensating, that hold those or house those skills, that when those parts of the brain are affected, they can't do them anymore, right? So we think about an infant's brain as it's developing. An infant can't do all what an adult can do, right? Because that brain's not fully developed. So as that brain develops, right, they're able to do more and become independent. So same thing in reverse with people with dementia, is that brain is shrinking and they're losing those areas of that brain. They're not able to do those skills anymore. Right. So it's more so to say, like, not treat the person living with dementia as a child. It's more so of, let's just understand what's going on. So that world, right? What does that world look like? Because we always say that people living with dementia live in a different world than we do. So what does that mean? What that means is, if you think about what an adolescent's experience is they're experiencing their world through their senses. Okay. What they see, hear, taste, touch, smell. That's how adolescents actually learn how to walk, how to talk. They're watching mom and dad, they're listening, they're mimicking, right? They're smelling experiences, right? That's how they learn in the first 5 years of life. And so we have to say, okay, so if someone living with dementia is going back to that state, their senses are going to be what they're going to rely on to navigate their new world. So that's the explanation part of it. So the tool part, which is the second pillar, is sensory stimulation. We have to use sensory-based tools that are positive. Why, right? Well, why? Because people with dementia are going to respond to them. But what's actually happening in the brain? So clinically, what's happening as we use sensory stimuli, whether negative or positive, it's going to impact the limbic system of the brain. And in the limbic system, we have two important organs. We have the amygdala, which generates emotions, and we have our hippocampus, which generates memories, right? So as any stimuli comes in, it's going to impact that limbic system and influence how they feel and their memories associated with that particular situation. Now, psychologically, because this is actually the dementia connection model is the first cognitive behavioral theory in dementia care. So what happens is when our emotions are influenced, it actually impacts our behaviors, right? So when that stimuli comes in, it's going to impact their feelings, their memories, and then their actions, right? So we want to use positive sensory stimuli so we can influence positive emotions, memories, and response behaviors, because we do know that people with dementia, they often do elicit kinds of actions that are not productive for themselves, right? They might become verbally aggressive, maybe physically aggressive, wandering, right? Sundowning kinds of behaviors. And this is not quality of life for them. They don't want to act in this way. So if we can influence it at the beginning with those emotions, then we can influence their response behaviors, right? From a psychological perspective, right? So the sensory-based stimulation, right, is the tools that you're going to use. And we have all kinds of tools we can talk about. The third pillar is how do I implement these tools? That's called habilitation. What that simply means is we're going to do this over and over again, right, to reinforce those skills. So we're going to, in a structured manner, every day, we're going to use these tools, at the same time every day to be able to reinforce those skills all the time. So they'll hold on to them much longer, right? And so that's the third pillar, is the habilitation, right? So simply put, we're going to use sensory-based tools that are positive in nature every day, and that's going to influence the person to feel positive feelings, memories, and response behaviors. And in turn, what happens with you as the caregiver is that you feel well-equipped, you feel confident, you feel competent, and you feel like you know what you're doing. You have actual tools that you can use, and you see their face light up. You see the person feeling calm, right? You see their appetite increasing, right? And so it's a no-brainer. It's a win-win, because the person with dementia wins and you win, right? And that's what's made the model so successful.
Well, and we're going to have links in the show notes and here up on the screen. But why don't you share with the audience how they can find or reach out to the Dementia Connection Institute?
Absolutely. So you can catch us at our website, dementiaconnectioninstitute.org. You can email us, support@neuroessence.org. As NeuroEssence is the executive team there at the Dementia Connection Institute. And we're on all social media platforms, Facebook, LinkedIn, Instagram, TikTok, so YouTube. You can catch us at any of those as well.
Fantastic. And again, I highly recommend viewers and listeners to check it out, because I think you guys are doing some groundbreaking stuff there. And we'll also have the link and up on the screen as well for your book through Johns Hopkins Publishing. Now, I want to kind of change gears here for a minute. In the senior living community, there's a big push now to reduce the amount of psychotropic medication used in dementia care. I actually just had some guests on, and we were talking about the use of those medications in the instance of using them as restraints, chemical restraints. Why do you think there is a push now to reduce the use of those medications?
Working in these facilities, I understand that, nurses and the teams, they're grabbing at what they have available to them, right? And a lot of these facilities don't have tools. They don't have a lot of investment in education. And that's where it starts. The senior living community, the organization, they need to invest in dementia training, especially because this is going to be their business for a long time to come, right? And so nurses will kind of grab at, or the team will grab at what they have and what they know works, right? And so unfortunately, when they use any kind of like a psychotropic medication that helps the person to stay calm, usually those are anti-anxiety kinds of medication, benzodiazepines, any kind of like insomnia types of medications, antipsychotics. Those are all going to calm the person, right?
They're sedative drugs, right? For viewers who may not know, they're sedation,
Yeah. So they're going to grab at those things to say this person is becoming aggressive. This person is becoming agitated, frustrated, and we don't know what to do. So we're going to grab at what we know. Right. And so there's such a routine for many, many years in senior living you call the doctor, you get a prescription, you implement that, and that's what you move on with your day. Right. But unfortunately, there's just been too much of a high rise with that, to be the first line is go to medication. Right. And CMS in 2000, I think it was 7, finally came out with a understanding and a requirement that senior living communities are required to use non-pharmacological intervention first before moving to the medication. So because that came out, it has helped. It has, there's been a huge push to reduce these medications in the dementia space. But I think we have a long way to go because we have to provide education and tools to the teams so they feel well equipped to say, okay, I'm not going to jump for the medication. I have this, I have that. I can use, my hands and my heart to be able to interact first. And if that doesn't work, and this person is truly a threat or a serious harm to themselves or others, then I'll go to that medication. But I think it got out of control because there were no really rules around it for such a long time, again, until 2007, which was, just 13, 15 years ago, something like that. And so before that, it just had gotten out of control. And I think that a call to action to it has been important. And we still have a long way to go with it.
Absolutely. And just explain why you think caregivers and families would want to see these medications reduced.
Yeah. Well, unfortunately, there's just a lot of side effects.
Right.
And we'll talk about the one that, of course, is the most serious, which is on most of these medications, the black label warning that says it can cause death in people living with dementia. So that's the worst case scenario, of course. But, there's a lot of other side effects, of course, the sedation we talked about. And that's the result you want. But when the person is too sedated, so many side effects after that keep happening is what I call it. It's like second and third tertiary kinds of side effects, right? The person has an increase in falls, right? They're not engaged as much because they're tired, they're sleeping more. That inevitably causes them to lay down more, which can affect their skin, right? We have a lot of skin tears, bruising, because the person is laying in bed a lot, they're not moving. You see a lot more increase in arthritis and neuropathy because, again, they're not getting the blood flow circulation, about moving it about and things like that because they're not able to do that. Right. We unfortunately then see a lot of return to hospitals where they actually are going to the hospital because they fell or because they have these severe skin issues now. We also see increase in depression, right? So there's just so many more kind of secondary and tertiary side effects that come from just the side effect itself, right? Above and beyond that, of course, there's people react with constipation, diarrhea, more confusion, which was not what they don't need, right? And so it's really unfortunate that there's these medications do cause these things. Of course, there is room for them when necessary, but it shouldn't be our first line of defense because, especially if the person has never been on these kinds of medications, this is a huge impact to their brain because of the sensitivity around their brain with the disease that they're struggling with.
Well, let's talk about alternatives then. So, I had actually Saturday, our church had a big Easter egg hunt, and, we had taken our kids there, and there was a grandmother there who, knew of me and things, and she had sought me out, and her mother is in assisted living, and her mother has some agitation issues and things with the dementia, and the assisted living facility had made the decision to then place her mother on a certain amount of Haldol every day. And and she just had drastically declined. She said, my mom can't get out of her chair anymore. She doesn't want to eat. She doesn't want to talk. She's basically, for lack of a better term, she's a zombie. And she said, but really what the straw was that broke the back here was her mom needed to use the bathroom. And, assisted living, nursing homes, for the most part, they're understaffed, right? Especially when you're dealing with, dementia patients and clients and things. And her mom, I guess, had put the call light on and finally the story goes she couldn't wait any longer, and she didn't want to, become incontinent, right?
Mm-hmm.
And she went to get up, and her legs just completely gave out,
Mm-hmm.
and ended up with severe injury. And she said, before the Haldol, my mother could easily ambulate from chair to bathroom, bathroom to bed, or, whatever the case is. But now since the Haldol, she's like, she has no strength in her legs. She has no coordination, balance. And she's saying, what can we do? The facility said, really, part of this is, we don't have the staff to tend to your mother because of her behavior and her wandering. Well, to me, she's not a candidate for assisted living at that point. You need to look into memory care facilities. And Haldol is being used as a restraint in that situation. She wasn't, having outbursts and everything. She wasn't violent or aggressive, but they were using that as, I call it like a nanny, a babysitter. Give her the Haldol, there she stays. But it led to her injury, not to mention the other, side effects that she's dealing with because of the medication. So the daughter's asking, what can we do? Because they won't take her back from the hospital unless we agree to allow her to continue on the Haldol.
Mm-hmm.
She goes, what other tools are available? So I'm going to let you answer that.
Absolutely. So it definitely is intentional, right? It's what are we trying to treat, if you will, right? And so in the case of wandering, we're going to go to our senses. What are sensory-based tools we can use? And so we have to find out, what does that person enjoy doing, right? What have they enjoyed for years, right? Or what do they respond to? And so a couple of tools that they can trial, right? One, I'm going to definitely say I'm a big proponent of aromatherapy using essential oils. Okay. Now, essential oils are newer on the market, not newest to skilled nursing, or to long-term care in general. There are several communities that have invested in a good aromatherapy program, but there still needs to be more education and mention about it, right? Because there's been tons of clinical trials that show essential oils are effective in dementia care. They're not FDA approved, and that's the only kind of trials and tribulation when it comes to there being kind of a stigma around it still, and it not coming forward with there being some hard regulation around it. But CMS actually recommends it in their guidelines. They say use aromatherapy, and so that's a no-brainer. They're telling you the answers, you might as well do it, right? So specifically with wandering, you can use lavender. Lavender is very calming, but it also increases mood, right? And so it helps to improve any kind of fear or worry or anxiety. And that's oftentimes why folks wander. They wander because they're not sure what they should be doing. They're not sure where they are. They're looking for something and they're not quite sure what it is they're looking for. So lavender is going to help calm them down to feel more focused and attentive on what's around them, right? So that can be easily diffused in that environment. At the Institute, we recommend we have what's called personal diffuser dots, which is a little sticker that goes on the lapel area, so it goes with the person wherever they go. So lavender is a great oil to start with when it comes to using aromatherapy. So that would be your olfactory scent. Now, some people say, well, isn't it true that people with dementia, they experience anosmia, they can't smell anymore? Absolutely true. But that's why essential oils are so effective, because regardless if they can decipher what the smell is, it still works. Because the molecules in an essential oil are so small when they're diffused into the air that when we breathe them in, they actually impact the limbic system directly. Okay. So it doesn't matter if they can tell if it's lavender, if it's rosemary, it doesn't matter. It's still going to be effective. Okay. So that's the olfactory scent I would recommend. I'd also recommend, again, what engagement things do they like to do? And so I always want to bring in a tactile component of this, because when we bring in a tactile component, what's happening in the brain that starts to process is called neuroplasticity, where our brain is forming new neural connections. But the side benefit to using tactile stimuli, and that's what we say here at the Institute, there's side benefits to our tools, not side effects, right? Is that there's a grounding effect that occurs when we do things with our hands, okay? And grounding means that it reduces anxiety and fear, increases attention and concentration. And that's the best recipe for somebody living with dementia. And so what can we do with her hands? And we talk about staffing, right? Staffing is an issue. You know what? You can actually purchase if the person was a mother, a grandmother, a great aunt, an aunt, whatever it was, if they loved children, you can purchase a doll and use doll engagement. You want to make sure the doll is looks lifelike in nature, that it has some weight to it, about 5 pounds, right? And get the accessories, clothes, diapers, blankets, bottles, right? Because if she loved being a mom or caregiver of some sort like that, right, she's going to take to that doll. And about moderate to late stage, what happens is they start to believe that this is an actual real live baby.
Right.
So they care for it. They find a sense of purpose in it, right? And they can be engaged for hours with it, And above and beyond that, you can take the clothes of the baby and they can fold it. You can give the person tasks. You can say, can you fold these all and organize it by size, by color, by type of clothing, right? And they can spend hours doing their laundry and caring for that doll, right? And that doesn't require staff time. You put these items in front of the person, they typically will go for it and start using it, right? And you could tell if they look at it and they're like a little like, ooh, right? Then that's not for them. Let's try something else. Do they love gardening, right? So are there some tools that they can have and put a pot with some soil right in front of them that they can get messy and they can start gardening and soiling right there, at a table, and it can be easily cleaned up, right? So let's do that if she liked that, right? So that's going to be visual stimulation, tactile stimulation. It can be an olfactory experience, especially with the soil if they're smelling it, right? So you can use dolls, you can use gardening, anything that they like with, things that they want to do with their hands from a tactile perspective, right? You can also use music, auditory, right? So usually what we call non-biharmic music, which is one tone, a violin playing, a harp, a guitar, or if they had a favorite instrument, we play that music, on an iPad. You can use headphones. You can do it on the TV, YouTube, right? Play these sounds that are pleasant and calming, right? And that's really going to ignite that limbic system to calm them down naturally, right? So those are just a few tools for wandering that you can use that are very multisensory in nature that bring that calming and security sense to that person, which will reduce their wandering.
If somebody's watching or listening to this, Jennifer, and they're saying, I don't know if I could do this, do they need training to do these tips?
I always encourage any caregiver, whether your loved one is if your loved one is living in a facility or you work in a facility, you're a care provider that way. Yes, I think you do need training. I think it's important. Not that you have to invest a ton of money in it, but there's lots of training out there that you can educate yourself. It's important because then you feel well equipped. You feel more confident that you can do this. And so I do encourage through the Institute or through any entity that you get yourself educated as much as possible on what is this disease, what tools you can use, so that way you can spread the love and share it with other people. So it is really important, no matter your role as a caregiver, whether you're caring for someone at home, whether your loved one is in a facility, whether you are the staff member in the facility, it's very important that we get trained and we spread that love.
But by using these tools that you're mentioning and getting some training and, just some support, just so they get some of their own confidence as well, how do you see that correlating between the reduction in these psychotropic medications and these sedative drugs?
Oh, absolutely. I've seen time and time again, when we are not using the psychotropic medication and using these alternatives, right, what we see is we see less falls. We see a less, increase in psychotropic medication. I've actually seen folks decrease, if not what we call discontinue those medications, because now we have alternatives, right? We've seen a decrease in return to hospitalizations, a decrease in depression, almost a kind of a stabilization in cognition for a period of time. We also see a decrease in skin issues, right? So it's like, again, that second tertiary side effects we were seeing, we're actually seeing side benefits that those things are not happening, which is absolutely wonderful. And when we talk about who prescribes psychotropic medication, it's typically psychiatrists, right? And I have talked to so many psychiatrists over the years, and they've told me, hey, if the facility is willing to use these alternative tools, I'm willing to support that.
Yeah.
But these folks don't have these tools. So the only thing I can give them is medication. When they call me and say, hey, doc, what do I do? I'm going to prescribe because the team doesn't have these tools.
Right.
So that's all I know what to do. So psychiatrists are on board with these alternative tools. I've actually had psychiatrists write orders for essential oil use. The company decided that they would want, some kind of order. So that way, when public health comes in and audits them, it looks kosher. And psychiatrists will do it. They'll say, may use essential oils, right? And, they're not going to prescribe how much and all that kind of stuff because they're not educated themselves, but they're going to support it, right? And so psychiatrists say, hey, if I know that the team is using these tools, I'm going to encourage them to use those tools first, right? So psychiatrists are on board. They just want to feel confident that the team at the facility is educated.
Well, and I want to kind of stick on this for a minute. So how would you, when you're a lay person and you have no background, you have no real education, and maybe a month ago or a week ago, your mother, your father, or your spouse receives a diagnosis that now they have dementia. That's a big, that's a big, heavy cloud over you now, because none of us grow up planning to be a caregiver. A lot of people always have, it's never going to happen to me mentality, that sort of thing. How do you recommend, or how can you give them the confidence to kind of stand up for their loved one and say, I really want to reduce the amount of medication that my loved one's receiving? How do you approach that conversation? Because when you have a white coat syndrome, right, and you're standing in front of that white coat and you got that 5 to 7 minutes to talk with them, and maybe they're getting half of what you're saying, it can be a little intimidating. I think we can all agree with that. And especially when you don't have the knowledge or the background, how would you recommend a person address that issue with the physician or the facility or whoever it is if they are wanting to reduce those medications that their loved one's getting?
Yeah, I would first absolutely encourage advocating on behalf of your loved one, because, unfortunately, like you said, in these facilities, they're often understaffed and they're trying to do the best that they can with what they have. Right. And so if you advocate and have a voice, that's going to be your best kind of first step in this. But the way to approach is to say, I'm willing to be open to alternatives, alternative tools. I'm willing to be open to trying different things, whether it be that if the family is willing to kind of invest some of the money in it, or is willing to be open to suggestions from the team, because sometimes the team will offer things and the family's like, oh, I don't want, there's too much stigma around that. Like I talked about the dolls, right? There's a lot of stigma still around dolls, and I get it, right? It's like, you don't want to see mom or dad, playing with a doll as if they're a child, but that's not the point. The point is that it brings so much joy to them and it works, right? Isn't that what's most important, right? And because we learn about the theory of retrogenesis, they're going to move toward infantile state. And what do children play with? Dolls and stuffed animals, and it brings them joy. So we've got to remove our expectations. We have to remove our own stigmas around it to say, well, is this going to work? Try it, right? So if the team is willing to come to you and say, can we try doll therapy? The family's got to be open to say, let's do it, right? And see if it works, right? If it doesn't work, then we move on to something else. So I would say definitely being open to trying other tools, and or suggesting the tools that if you, a caregiver, have been educated and you want to try some of these sensory-based tools, and say, hey, such and such organization or such and such team, would you be willing to try this with my mom? Then, and you're willing maybe to, if the organization can't afford it, would you be willing to do it? Because these things don't cost a lot of money. But, when they think about it from a perspective of, they need to be able to service all of their dementia residents, sure, that can add up a little bit, So if you're willing to do that too, that would be helpful.
Sure. And you mentioned social prescribing. Talk to us about what that is, because some people may not be familiar with that phrase or that term.
Yeah. So social prescribing essentially is looking at the overall well-being of the person, right? And 70% of our health is actually driven by social determinants, meaning how we live our life, how we're engaged, what we're involved in, our education, right? It's not necessarily our physical health. So our overall health comprises so much more than our physical health. So when we talk about what makes us thrive, right, it's really how we engage with other people, right? Humans are social creatures for the most part, right? And when we think about how the pandemic impacted so many people, the rise of depression, suicide, divorce, addiction, right? All of that stuff happened because we weren't able to socialize with other people. Right. And what's the first thing that companies and we as individuals did, we found alternative ways to socialize through Zooms, virtual experiences, those kinds of things, right? Social media, right? We found a way to still socialize in a way where we were still, when we were separated, right? And so social engagement is so important. And so we talk about, well, what is the prescribing part of it? Essentially, it's, it's using these kinds of tools that I'm talking about and scheduling them throughout the day, right? So it's almost like, I'll give you an example. So instead of saying, okay, we're going to give mom, such and such milligrams of Ativan daily at 3 p.m., which will, of course, make her calm down so she hopefully doesn't sundown. What we're going to do is we're going to put in 5 drops of lavender essential oils in the diffuser at 3 p.m. every day, and we're going to diffuse that oil, right? And that's going to calm mom down so hopefully she does not sundown, right? So it's basically, as a caregiver, you're kind of prescribing these social kinds of tools or alternative tools on a daily basis, and you're giving them to your loved one, or the staff is giving it to their residents as if it's a prescription. Right. And they're doing this every day like they would be medication compliant by giving their medication every day. They're going to use these tools every day in the same fashion. And that's social prescribing.
And I think it really, like with the oil therapies, I look at it as like what music therapy was maybe 5 years ago. Absolutely. Right, where now it's recognized and it's part of, services and therapy programs. Where do you envision, or how long do you see, or do you envision it taking for oil therapy to reach that acceptance, more, widespread acceptance and implementation?
Yeah, that's a tough question, because honestly, aromatherapy has been around for centuries and used most commonly in other countries, right? And it started to become more prominent here, around spa services. So we're used to, if we go get a massage or a facial, that, hey, do you want some aromatherapy? Sure, right? And then it kind of spread into local markets where you're seeing it in, different stores and things like that. And I would just highly recommend people stay away from buying essential oils in stores because they are contaminated. It's the way that they're able to sell them more, cheaply to the consumer. But with that said, it's hard to determine how. I think that overall, as a population, we're becoming more educated on health alternatives, right? And again, CMS, started recommending it a few years ago in their guidelines, and so I see it becoming more and more vast in long-term care. So when it will be widely accepted, it's kind of hard to tell because you're always going to have people on both sides of the fence. You're going to have people who are more Western medicine focused, people who are Eastern medicine focused, and I myself am both, right? I'm open to both. And I think that's where we need to kind of create the culture, is that both entities have a space. Sure. And both should be used in various entity when needed for different, intentions, things like that. Where I want to see it become more of an acceptance, right? I think where it will become more widely accepted is when insurance covers it, right? When long-term care companies are paid to use it, right? Because they're paid for other services. They should be paid to use these tools too. And that's often why some senior living organizations can't invest in it, because they don't have the money for it. Right. But if they were paid by CMS through Medicare to use essential oils or to use a doll, right? You better believe they'd want to use it, right? Sure. So when insurance can cover it, whether it be Medicare, whether it be, supplemental insurances, that's where I think it'll be widely accepted. And we need to drive towards that. And I'm a huge proponent for that change, to say, if we're covering all these medications, why can't we cover essential oils? Now, I do have to say that it has started a little bit in New York. Okay. Blue Cross Blue Shield started covering essential oils in New York as the wellness benefit. So you have so much money towards your wellness benefit. You can choose to spend on any health kind of entity, whether it's a gym membership or using essential oils. But we need to go above and beyond that. We need to be able to have these tools covered, and I'm going to drive it for dementia care, right? So that way it can be more widely used and accepted. Okay.
Well, it'll be interesting. I think over the next 10 to 15 years, I think we're going to see some dramatic changes. I really do. Through even home care being covered through Medicare and private health insurance.
Absolutely.
Because, yes. To me, we had a case maybe 4 or 5 years ago where the private health insurance company called our company and wanted us to do an assessment and an intake for one of their insured, clients. And they said, before you say anything, we realize we don't pay for these services, but in this case, we're making an exception, which was just like groundbreaking.
Yes.
And they said the logic was they decided it would be more affordable and more economically advantageous to care for that person in their home than put them in a facility. So we took care of them. The insurance was paying for it. But I've always said, but wouldn't their logic apply to everybody that wanted to, instead of going into a facility, it would be more economically advantageous to stay in the home. So I think those changes are coming. I just think it's a matter of when and not if myself.
Yeah, I 100% agree with you. Home care, even assisted living should be covered, and it's not.
Yeah.
And it's like, they have to realize once they get to skilled nursing, it's very expensive to take care of a patient in skilled nursing. Why don't that be proactive and cover the services before to hopefully prevent them to go to skilled nursing?
Absolutely.
Yeah, it's a no-brainer.
Right?
Yes, exactly.
So Jennifer, we want to thank you for your time. I just think this is fascinating, and want to thank you also for the tremendous work that you're doing at the Dementia Connection Institute. My last question for you is, where is the Dementia Connection Institute 5 years from now when we talk?
Wow. Well, it's amazing that you're asking me that question. And I have so much vision for our institute. And so when we talk about what's on the horizon, we had built 2 certification programs that came out last year. People can become certified in the Dementia Connection model and become Dementia Connection specialists, so DCSs. And that's open to all caregivers, no matter of your educational status. So family caregivers, folks in facilities who are working in senior living. We also have a trainer model as well. So someone who's a healthcare professional can become a trainer and train others to become DCSs. So that's live, that's out there. Check us out at the website to sign up if you're interested. We are actually at the brink of launching an online classroom called the Dementia Connection Classroom, where any caregiver can log on and receive dementia education, because as we talked about today, it's so important. So it'll be affordable education that they can use on the go. So we're going to have packages for families, versus healthcare professionals versus organizations. Okay. So that's on the horizon, hopefully to come out here in the summer. Then from there, we are looking to develop our own podcast. So maybe you can help us guide our way here. We have a vision to develop an app on your phone where you're able to use the Dementia Connection model and be able to have those tools at your fingertips and collect data and see what's working and what's not working, that kind of thing. So there's a lot to come, absolutely. I'm looking to, hopefully open a support group at some point too, where, all caregivers are welcome to come and whatnot. So I have a lot here, just need to kind of get it down on paper and get it moving. But yeah, further development. So, you can stay tuned to us. If you get our email listserv, you'll get emails to kind of keep you in tune of what trainings we have coming, what educational seminars, and what we're developing at the Institute.
Wonderful. Well, best of luck, and we're looking forward to seeing all the progress, and hopefully we'll have you back on again in the future.
Would love to. Thank you so much for your time.
Thank you. Have a great day.
This may be familiar to you. All too often you want the best for the person you care for, but time and time again, the interaction just doesn't seem successful, leaving you feeling less connected to the person and potentially sad, frustrated, and hopeless. The Dementia Connection model brings together 3 known pillars in dementia care into one framework: the theory of retrogenesis, the act of habilitation, and using sensory stimulation to create sensory-based information for the person with dementia. The first pillar of the Dementia Connection model is the theory of retrogenesis, created by Dr. Barry Reisberg. This theory says a person with Alzheimer's disease loses brain functions in the reverse order that they learned them. Therefore, all their skills will go in reverse from adulthood to infancy, like how they walk, talk, take care of themselves, cope with stress, etc. Consequently, their chronological age will eventually not match their developmental age. Dr. Reisberg found that those with more advanced Alzheimer's disease may be in a state where their developmental age is anywhere between 7 years old to 4 weeks old. So, although you may be taking care of someone with dementia who is 80 years old, they may have the skill abilities of a young child. However, his theory does not support treating the elderly like children, Although the acceptance of the person's current skill abilities is crucial to understanding what they can and cannot do, and to lower the expectations that the caregiver may have of the person with dementia. This allows you, as the caregiver, to be fully present, not blocked by thoughts that lead to sadness, frustrations, and hopelessness. The second pillar of the Dementia Connection model is the active habilitation. Simply put, it is important to consistently reinforce the skills the person still has. There are two known skills a person with dementia has as the disease progresses. One, because we know their skills are reversing toward a younger state, they will navigate their new world similarly to how infants, then children, navigate theirs, using their senses to take in sensory-based information. Young ones will use their senses to learn meaning, and then what things are called, from the use of auditory, visual, olfactory, gustatory, and tactile stimuli. 2, they can still feel a full range of emotions. Although they may not be able to express those feelings through words, they try to communicate them through behavioral expressions, similar to how children communicate before they know and understand words to describe their feelings. To put these together, stimuli from the outside either directly or indirectly influences the limbic system of the brain, which houses our mood and memory. So stimuli can influence our emotions and our memories. When we reinforce our emotional and memory skills in a positive way over and over again, those skills will stick around for much longer. Also, specifically, the person with dementia will start to associate those positive feelings with you, who is providing the positive stimulation, creating a deeper connection. Therefore, the third pillar of the Dementia Connection model is using positive sensory stimulation to create this sensory-based information for the person with dementia to take in that will influence their emotional and memory skills. So, your approach should be using various sensory techniques that are positive and preferred by the person, like playing their favorite music for auditory stimulation, using essential oils that have therapeutic benefits for olfactory stimulation, offering their favorite foods for gustatory stimulation, reminiscing with pictures for visual stimulation, and painting for tactile stimulation. You can influence the person with dementia to feel happy, safe, secure, and calm, and also to be more focused and attentive. How great is that? The key to using the Dementia Connection model is the 3 R's: routine, remind, reward. Essentially, consistently use sensory stimulation cues, and it will boost the mood and memory of the person with dementia, and they will feel more connected to you. Also, a bonus, when you feel you've mastered this, then it will also boost your mood too, and you will feel connected again to that person.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Dr. Jennifer Stelter for joining us today here. Thank you so much, and we look forward to seeing you next time at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.